Hi, I'm Sarah with the Tennessee Disability Coalition. We work to improve the lives of Tennesseans across age, across diagnosis, and across the state of Tennessee. These are challenging times, and it's never been more important that we support one another, which is why we are sharing the message that we are in this together. In that light, I'm coming to you from my couch to yours with a public policy update. So what's going on in response to COVID-19? Well, at the federal level, Congress has passed the CARES Act, or the Coronavirus Aid, Relief, and Economic Security Act. There is good information on the IRS website about the tax help that's included in this bill. And I'm sure you've heard that there will be direct stimulus payments for individuals that will be issued based on the last tax return you filed. But what happens to those who don't file taxes, like veterans, low-income seniors, people with disabilities, folks on supplemental security income, or SSI? We're not sure yet. So we've started a call to action to the heads of the U.S. Treasury Department, Veterans Affairs, and the Social Security Administration to ask that these folks get automatic payments just like everyone else, but not asking them to file taxes because they normally don't have to. Also at the federal level, the Centers for Medicare and Medicaid Services has issued an 1135 waiver for Tennessee that waives certain regulations during emergencies, which makes it easier to provide services to Medicaid recipients. So it waives background checks, state licensing, initial site visits, for example. In Tennessee, the Tennessee State Legislature has adjourned for the time being. Now they plan to come back June 1st, but we'll see. And we'll see if when they come back, they will pick up business as usual, or if it will be a very abbreviated end to session. Governor Bill Lee has issued a number of executive orders that make temporary changes to state law. So the most notable of these is the stay-at-home order. But he's also made it possible that healthcare workers from out of state can practice here and encourage insurers to cover telehealth services during this time, for example. His departments of state government have also issued guidance on how to continue operations during this time. So for example, TennCare is still taking applications for Medicaid. Importantly, they have paused eligibility redeterminations. So that means that everyone who's on TennCare now will stay on TennCare through this epidemic. They have also, through the Department of Intellectual and Developmental Disabilities, issued guidance that direct support professionals are essential personnel. So folks who with disabilities receive care by direct service professionals will continue to do so. Quick shout out to all our DSPs because your work is hard and there was already a critical shortage. So if you're going to work and helping out my friends with disabilities in their homes at this time, thank you. The Department of Education has also issued guidance, and this is how to provide education to students despite school closures. That includes special education services and related services like therapies to students who have an IEP or 504 plan. The Department of Health, importantly, issued guidance actually in 2016 around what to do if we had a critical shortage of healthcare supplies during an emergency. And those guidelines, unfortunately, exclude people with advanced neuromuscular disease who require assistance with activities of daily living or require chronic ventilator support from receiving critical care, including ventilators, which have become really important during this COVID crisis. So in response, the Tennessee Disability Coalition, the ARC Tennessee, Disability Rights Tennessee, and partners have filed a complaint with the U.S. Office of Civil Rights because everyone has a right to critical health care. We've heard back, and the Office of Civil Rights is investigating a number of states' rationing plans to ensure that they comply with the Americans with Disabilities Act. Governor Bill Lee also addressed this guidance and said that they do not intend to follow it during this time and will be removing it from the state's website. We are still asking that the state issue a strong statement of anti-discrimination to ensure that everyone who needs healthcare can get it during this time. We've also developed a one-pager that lays out the rights of people with disabilities to healthcare based on some great national resources. We will link to it in the post that accompanies this video. We advocate for the rights of Tennesseans with disabilities during crisis and when things get back to normal. But we issued some guidance to the top 10 cities in Tennessee, their mayors and Americans with Disabilities Act coordinators on our thoughts on how to ensure people with disabilities are included in emergency response during the COVID crisis. We are also sharing resources. We will link to partners and guidance from the state in the post that accompanies this video, and wanted to share that the Tennessee Justice Center is gathering stories from folks who would benefit from increasing access to Medicaid, especially during this time. In this time of national crisis, it's an important theme that's emerging, that as we create more flexibilities so that people can continue to be served, we must remain vigilant that our rights and protections are not being sacrificed. We will keep you abreast as we continue to follow this. Thank you for joining us, and thank you for staying at home. When you stay at home, you're saying you're in this together for people with disabilities. Until next time, be well.